So when we're trying to talk about advanced care planning and educate our patients about planning, it's often in the context of a consultation. So you're already in that interaction between you and the patient, but they're very much focused on their more immediate health concerns. And so you want to try and steer or move a conversation from the immediacy of their health concerns and try and get them to start to think about things a little bit more broadly. How are they managing in a broader context, home, family, carers? Have they spoken to their own carers and family members about some of the issues that are really sort of relevant to their situation at the moment? So you start off very much focusing on them, their immediate issues and concerns, broaden it a little bit, and then maybe it might be in that conversation or it might be in a subsequent conversation, start to use words around advanced care planning. Have you ever communicated? Have you ever written down? And it starts just to broaden it. So you don't want to focus immediately on the form or a process. You want people to actually engage and know that it's about the dialogue between you and the patient, or you and your other doctors and health care professionals. I think also that the process is an ongoing process. It's not an all-in-one sort of conversation. And again, it depends on the situation. It depends on what's of their immediate concern. If you're sort of working in a patient-centred way, you need to answer their immediate concerns, but you can introduce a broader context. And that's, again, the skill of a clinician in communicating effectively to a patient and a family to be able to do that. And I think it's a role of a clinician to have that in mind, that they need to broaden it, not just focus on the one situation or the issue that they've come in for. What you want to do is to try and communicate about the whole notion of care being the best care for the appropriate time. And so I try to allay that fear by saying, look, we're always working and hoping for the best. We want to always focus, when you've got an immediate health concern, that we would like your care to be the best care that can be for you. But there may be a time when either you might be unable to be part of that decision-making process, or it may be that the particular health issue means we've got to take a different course and different action, and we don't particularly understand, no one will understand or know what you have thought or felt or communicated to other members of your family. So this is a good opportunity to convey those wishes, convey those thoughts, have them on paper so that we can work with them each time that we see you or we connect or we have to think about your health or if things are changing. Normally we would think, when we're asking patients to think about advanced care planning, there's a number of things that they should start to think about. One is obviously really around what they would anticipate to be their quality of life. So some very general things about, have you ever thought about what quality of life means to you? And just to hear from them, what are some of the things that mean it? And it may be connection with family, it may be work, it may be whatever they're doing in their retirement, it may be their health issues, a whole lot of things that you don't ever assume. So one is to get them to maybe focus a little bit on what does quality of life mean at this particular time for them. It could be being with the grandkids, it could be going out and eating and drinking and enjoying social engagement in certain levels. So I think focus about that. Are there values? Are there things about their being in the world? There's spiritual concerns, the faith concerns, things that are really, really important to them. That's one component I think you've really got to sort of focus on. The other thing I think they then need to think about is, well, if we are going to write something, put something in paper, is there somebody else that you want to communicate with about this? Do you want to engage people within your family, your spouse, partner, children, so forth, friend, somebody that you feel is important to you, but also raise the fact that maybe one of those people might be somebody that should be your spokesperson for if there wasn't a time when you couldn't communicate effectively. From that collective of people that you think are important to you, to nominate somebody and to start to think about, do you want to go down the pathway of nominating people that might be able to represent you medical issues, as well as think about the people who might nominate for financial issues. So the two sides of the equation. So I think they're mostly, for me, the initial key things that need to be thought about. A couple of other things need to be considered, and it's like not only if we do go down documenting these things, is it accessible? Do people know where they are? Is it something that we would like your doctor to hold on to, like a GP? Is it something you want your solicitor to hold on to? So some of those more pragmatic, practical questions. And again, make sure that they're aware there are kind of the resources, there are the places to go and get more information. And then finally, just a sense of making sure that they reconnect to the process. So we don't just have a conversation and say, these are the issues and these are the concerns, that some other point there's a reconnection to see just how far they've got in the process. And of course, there's always the need to make sure that best care is clinically driven, but there can be other factors that can come into play. So it is about meeting. The decision is a kind of a sharing of what's important to the patient in terms of their context and what's important to the hospital and the clinician in their context, and how can you best work through that together. But by naming it as advanced care planning, it gives an opportunity for both sides of the equation to come together. Again, I think when we're focusing on actual decision making and health decision making with clinicians and at the sort of coal face, I'm increasingly aware that a lot of our colleagues, our junior colleagues, our younger grad nurses, our junior doctors are very much already in this sort of space, and often it's people who've maybe been in the healthcare system a little bit longer who find it all a bit confusing as to what advanced care planning is all about. And I try to focus on the fact that for many years most clinicians have been having conversations with patients and families, and it's informally they've been involved in making advanced care planning. It's just not acknowledged that's what the process is, and we've now decided to call those conversations advanced care planning, and that we're trying to formalise the process. So advanced care planning is a very active process. It is all about conversation, it's all about giving context to the medical decision making, it's hearing from patient, family or their advocate agent about their situation and context, and really sharing the decision making, but recognising there is still the need to have that clinical context, and that again, together those decisions are made, discussions are made. Now sometimes the predominance is the clinical decision making and either the escalation, limitation, whatever the focus is. Sometimes the predominance may have a much more stronger familial, social context, depending on what's been decided, written, discussed. But every time someone presents to a healthcare place or a facility and a conversation is occurring, those considerations need to come back into play.